Welcome to another episode of the Simple 7 Lifestyle Podcast. I'm Dr. Jerry Duggar, and I'm glad that you're with me today. It's been close to 28 years since I first started chiropractic school. And back then, I noticed there were a lot of people who didn't really understand. They didn't know much about chiropractic. Since then, I think the average person knows a lot more, but there's still a lot of misconceptions and a lot of misunderstandings when it comes to what I do all day long as a chiropractor. And so what I wanted to do today was talk about and share 10 things that I think are really important for you to understand about chiropractic, because it is such a powerful tool for our health. Not only is chiropractic really a powerful modality for healing, it's very unique. It occupies its own little niche, its own little spot in the healthcare world. And so although it overlaps with a lot of other professions, it's pretty distinct. So let's talk a little bit about chiropractic care and why I think it's just the coolest thing ever. So first and foremost, number one thing, I need you to know that chiropractic is about a lot more than just your spine. Many people have no idea that chiropractors are so well qualified to give expert opinion and advice on nutrition and fitness and ergonomics and other elements of your lifestyle. We can screen for a whole bunch of health conditions. I'm regularly running blood panels and helping my patients interpret what's going on in their blood work from their medical doctor, not because the medical doctor couldn't do it, simply because they often don't. Most of the time you get a nurse that calls you back and says, "Everything looks good, Mrs. Jones." And that's just not enough. There's tons of information hiding and it doesn't get discussed. So because chiropractors are usually a little bit more proactive and preventative minded, we're really great assets to have on your healthcare team to run all sorts of things by. Chiropractors are able to complete specialties in pediatrics, in sports rehab, in neurology, in clinical nutrition, and addictions and compulsive disorders and mental. It's just, we have a broad base education. And if you look at the number of hours chiropractors spend compared to every other, doctoral level of healthcare provider, they're equivalent. It's the same amount of schooling. There's different emphasis between these different professions, but the total basic, fundamental understanding of how the body works is quite comparable. Where I may take hundreds more hours in anatomy and physiology and musculoskeletal system understanding, your medical doctor has to spend those hours studying disease and pathology and pharmacology. So I don't study those things nearly as much as they do, but there's no one better qualified to talk about anatomy and physiology of normal function of the body than a chiropractor. Okay, so number 2 point. Chiropractic really is for all ages. My oldest patient I've treated was well into their mid-90s. My youngest patient I've ever treated was a few days old. So many seniors aren't aware of just how much benefit they can get from chiropractic care to help them move more freely and have less pain and aches in their body, increase their range of motion, improve their balance and their coordination, decrease the speed at which their joints are breaking down and developing arthritis. And I love to help my senior patients get the most out of their life. We know that when people slow down and stop moving, the aging process really just goes crazy, right? It takes off. So we need to stay as mobile and active as we can for as long as we possibly can. Now, I mentioned in my patient that's a couple days old, there's really not a too young for chiropractic segment, okay? We check infants right after they're born because birth itself is incredibly stressful on the newborn spine. And sometimes, especially the more complications are involved, the more things are done to the baby that might introduce trauma to the neck. So understanding that is really important, and being able to, feel the difference between a healthy and an unhealthy or an injured spine is really what chiropractors are well trained to do. So I take care of pregnant mommies and high school athletes and busy, stressed out executives. So if you have a spine and can fog a mirror, it's likely that chiropractic could help you. All right, number 3. It's important to understand that pain usually shows up late in the degenerative process of the body. Of course, acute injury, slip and fall, muscle strain, muscle pull, these things, happen in the moment, right? And pain begins immediately. But most of the time, people are dealing with chronic problems that have gradually developed over years and maybe even decades. And pain shows up a little bit late in the game. And I see this often where a patient will come in and they swear that their pain just started 2 weeks ago, but we take an x-ray and there's 2 decades worth of spinal degeneration and arthritis in the joints. So if we're waiting for pain to show up before we think there's a problem, we may really miss out on a lot of time where we could improve the function and prevent a problem from existing. It's also important to note that the absence of pain doesn't necessarily mean health. Just because you can make the pain go away doesn't mean you've made the actual underlying dysfunction go away. So that's an important piece. You have to get to the root of problems, and many times these problems are developing silently. So that really speaks to the idea of a wellness approach or a preventative approach, and why chiropractors often see patients who are not in pain at them. We're trying to solve problems before they become painful, and we're trying to prevent problems from coming back once we've already addressed that initial pain that might have brought them in. Okay, so speaking of pain, number 4, adjustments shouldn't hurt. They don't cause damage. Some people get the mistaken idea that because they've seen a kung fu movie from Hollywood, that a twist of a neck just drops somebody and they're dead instantaneously. And, therefore, any adjustment of the spine is a super dangerous event. The fact of the matter, it's not. Do you have to be careful and know what you're doing? Yes, don't trust your friend or your spouse to go doing a spinal adjustment. That's not a good idea. But somebody who's adequately trained and knows what they're doing knows how to prevent problems and knows how to treat things without causing more problems. So a chiropractic adjustment should be relatively painless. I mean, maybe tender or something if you're in pain already, but it shouldn't cause any pain and it shouldn't cause any damage. You don't need to worry about that. Now, what's up with this popping noise? I mean, every joint in your body has fluid around it, and when you stretch that joint, that fluid turns into a gas, creates little bubbles, and that's called cavitation, and it makes a noise. Every joint in the body can do that. There's nothing really that connects how loud a pop is with how effective the adjustment or manipulation was. That's something lost on so many people right now. I never would have believed this, but evidently you can go on YouTube and watch chiropractors treating their patients on video, which I thought was a violation of patient privacy, but somehow they do this. And, the captions are like, loudest pop in the universe, whatever, all this kind of clickbait stuff to make you want to watch. And what you see are pretty aggressive, sometimes almost violent looking manipulations done and loud pops. And the patient goes, oh, that was amazing. And somehow we kind of are continuing to correlate the popping noise with the correction of something. And I'm here to tell you, there is no connection. Joints make noise. Many great adjustments don't create any poppy noise. I mean, it's not what we're going for. It doesn't mean something's happened that's beneficial to you. It's just a side product of what we do. So don't get too confused about big loud pops thinking that means anything. All right. I could go on a big rant about how cheap it makes our profession look when people are making videos like this, but unfortunately, nobody cares about my opinion. People are going to do what they're going to do. I certainly wouldn't go to a chiropractor who videoed all their patient treatments and put them up on YouTube for likes and going viral. Anyway, that's beside the point. What we're going for is improved function of the body, whether that makes a noise or doesn't make a noise, and it shouldn't hurt. Okay, so number 5, let's think about this idea. The nervous system really is the king. The brain and your nervous system run your entire body. The reason chiropractors even care so much about the spine in the first place is because all of the nerves coming from your brain down to the rest of your body are going through the spinal cord and exiting out between spinal bones. That's where those nerves can get irritated, impinged. It can compromise the way that the body is communicating with itself. Chiropractors care a lot about the spine because we care a lot about the nervous system. We want your body to be in perfect communication with your brain so that the brain can control what's going on. So when there's a spinal misalignment or an area of damage, inflammation, swelling, it may interfere with the function of the nerves. And we call that a subluxation. And that's not a term that most people have heard before. It's kind of something that chiropractors talk about more than any other type of profession. But it's a misalignment or an area of the spine where there's dysfunction in the spinal joints, and it's affecting the way that area moves, it's affecting its alignment, and it's affecting the nervous system. Now, this is also why, even if a chiropractor is helping somebody with heartburn or irritable bowel syndrome, or a child who's got a bedwetting issue, or a young woman who's having a hard time conceiving, it's one of the reasons why chiropractors might look towards the spine and add that to whatever other treatments or recommendations they're recommending for somebody. Because the nerves going from that organ to the brain are going through the spinal column. And there may be an area of the spine that is affecting what's happening in those organs. I always explain it like the fuse box in your home with all of your electrical running to it. So you've got a main power coming into the electrical box, and then from there, it branches out and goes to all of the outlets and light switches in your home. And if you overload a outlet, it trips the breaker downstairs in the fuse box. So one, we have to take the stress off of the outlet. We have to unplug a few things, okay? But then we also have to go downstairs to the fuse box and kick that breaker back on. So chiropractic may be helpful in addressing underlying organ problem with diet and lifestyle, nutrition, and these other things. But also we may have to go and address a spinal issue that may be compromising that, or at least related to that. Doesn't mean that a chiropractic adjustment fixes everything by itself, although it's incredibly powerful, but it may be part of an overall approach to healing. All right, number 6. So this piggybacks a little bit on the last concept. If chiropractors help nerve communication and help the brain control the body better, it stands to reason that getting chiropractic care can help athletes improve their performance, right? Virtually every professional athlete has a chiropractor that they're working with. Golfers, tennis players, basketball players, soccer. It doesn't really matter what your sport is. If you're wanting the most out of the way your body functions, you need a chiropractor as part of the team. We play a prominent role in preventing injuries and also maximizing performance. All right, so number 7. Chiropractors don't heal anything. What do I mean by that? Well, the truth of the matter is no doctor heals anything. The healing happens from the inside, right? Your body heals itself. Best doctor in the world, all they can do is create an environment with which your body can repair. And as a chiropractor, I work to restore proper motion in the joints, to relieve tension on the nerves, to balance the function of muscles, to educate you on appropriate healthy lifestyle. These are all just designed to create an environment where your body knows that it can respond and heal. And that's an important mindset to have from a physician, somebody who is humble enough to know that they're not the ones doing the healing. Sometimes we tend to show up at a doctor's office and expect that they're going to give you something in a pill form, or they're going to do a surgery that's going to actually heal you. And that's not how it works. We want your brain and your body to be functioning the way it was designed to. And our job as chiropractors is to create that environment and teach you how to maintain that environment. Okay, so number 8, chiropractic may help you get sick less. And I just wanted to talk about the fact that the chiropractic adjustment has a profound impact on the function of your immune system. This has been widely studied over the decades, over the 100 and some odd years that chiropractic's been around. The nervous system and the immune system are constantly in communication. And when there's stress on the nervous system, there's stress on the immune system. As far back as the first deadly flu pandemic in 1918, chiropractors have been helping people with immune issues. And they noticed way back then that the patients who were getting chiropractic care tended to have better outcomes than those who were not getting this care. So that doesn't mean that that's the only thing you need to do to be well and to manage, your immune system. But it's, again, we're talking about performance of the entire body, and I want to just pay special attention to performance of your immune system. I see this in my practice all of the time. When a person calls in and says, I feel like I'm just coming down with something, I want to cancel their appointment. Honestly, I usually tell them that's the best time to come get adjusted. Sneak in, let's give you an adjustment. Let's make sure the office isn't just full of patients. We'll bring you in at a time when you can be here by yourself. Let's give you an adjustment. That may be exactly what your immune system needs to kick this infection as quickly as possible. All right, so number 9, another thing you need to understand about chiropractic is that because we're really in a working relationship with our patients over time, success in the chiropractic office depends a lot on patient engagement. This is an active participatory relationship. You can't just show up and have a treatment done to you and take no responsibility for what happens after you leave the office. So I see this unfortunately happen sometimes where somebody comes and says, oh, I went to a chiropractor once before and it didn't help. I kind of cringe, to be honest. I get the feeling that they really missed the whole concept. It's like saying, well, I went to the gym once and I didn't see this big transformation, or I brushed my teeth once, and you get the idea. Like, what we're doing, working with the body to create a better balance, takes a little bit of time, and it takes some engagement and active participation by the patient. Most of the time, people don't understand exactly what's at the root of their problem and how it's developed, and how my goal is to help them change an entire pattern of the way their body's been functioning. It doesn't happen overnight, and it requires things that the patient's doing at home in between visits. So I wouldn't expect one adjustment to solve anybody's problems, but a comprehensive approach that includes what we do in the office with appropriate care at home that gives a patient responsibility, that sort of partnership works. All right, the last thing I want to talk about. A lot of people have heard the myth, once you go to a chiropractor, you always have to go to a chiropractor. You can see how if you don't have the understanding of what we're trying to accomplish and the process that's involved in that, it does seem like you have to go back again and again and again. But we're not trying to really keep somebody under active care, or we're not creating a problem that didn't exist already. What we're really trying to do is go deeper and deeper and deeper into the roots of why this problem developed in the first place. The other thing that happens is most of the time people start engaging with chiropractic care, they fall in love with how good their body feels. They don't tolerate having aches and pains anymore. It's like, oh, I know now I could go get an adjustment and I would feel much better. So they just do. That looks like, a lot of continued care, but it's not for the wrong reasons, if that makes any sense. I don't want anybody to feel trapped like they have to come to the chiropractor because somehow they're dependent on it and they can't function without it. In fact, they function much higher than they would have had they not been under chiropractic care. I think people kind of get addicted to feeling good. Just like if you start eating your veggies and you start sleeping better, you start paying attention to your lifestyle, you kind of want to continue to do those things because you feel so much better. So it has nothing to do with a dependency model. In fact, we want you to manage and maintain all of the aspects of your health and have chiropractic play its role in that process. All the other great things that you're doing. All right, so there you go. 10 important things to know about chiropractors and about chiropractic. If you're not under regular chiropractic care right now, I would suggest you go interview a few chiropractors and find somebody that resonates with you. If you come talk to somebody like me, we're going to be talking about diet and nutrition and lifestyle and sleep and all of these things we call the Simple 7 lifestyle. And part of that is going to be how to manage your structural system, how to be fit, how to be able to move freely without any pain, and really how to have your body working at its top. Okay, hopefully you're all a little bit more knowledgeable about chiropractic care, and maybe I've even busted a few misconceptions that you still had about chiropractors and about what we do. If you have any other questions about chiropractic care, please reach out to us. You can follow us on Facebook and Instagram, and don't forget to continue to like and share this podcast with people that you know might benefit from. Don't forget to write a quick review so that the algorithms can put this podcast in front of the eyeballs of the people who need to know this information. All right, until next time, let's go out and do something good in the world today.